Good afternoon. Thank you for tuning in today to learn about your secure mail account, how it works with your clinic, how it works for you in managing your own personal health care. My name is Jeff McKay. I'll be taking you through a few introductory slides today. With me is Mark Ayer, who is our Director of Customer Operations. So he works with patients and clinicians and staff at clinics to make sure that we get all their questions answered using secure mail and help them with their setup. Before we get started, in case you're having any trouble with your audio, we'll just leave this up here for a second. This is our recommended setup using your computer audio, but you can also dial in if that's easier for you. And if you don't want to hear anything, you can always just select no audio, but obviously we do not recommend that option. So that's Mark, and this is me, Jeff. So we've both been Brightsquid for, well, combined almost a decade and a half, working with people to help get secure messages throughout the healthcare system and make sure that we're improving the flow of information. Today we're going to talk about, how you can connect virtually with your care. Obviously, during these times with the COVID-19 pandemic, we want to stay out of healthcare clinics where sick people are maybe spreading germs. So SecureMail allows you to connect with your healthcare team and any member of it really remotely. So you can send them a message when a question might pop into your head, and they'll get back to you. We'll dig a little bit more into that. We'll talk about SecureMail versus regular email. We do get people who ask us, or say, I just want to use my regular email account. Don't bother setting that up for me. And they try to get their clinic to do that. We'll talk about why that's not a good idea. We'll also talk about some of the clinical benefits. So by using secure mail with your clinic, you are actually helping your clinic be better at being a clinic, help them be more efficient and effective. And we'll look at a demo. We'll also talk to you. So we have a patient user. We did an interview with them earlier in the week. They weren't able to make the time today, unfortunately, but we'll play that sort of to get a deeper perspective of a patient who's been using secure mail for a few years. And then we'll look at a demo. So Mark's going to take us through, here's how secure mail works from a patient perspective. Here's the things you can do with it. And then of course, we'll look at, sort of what other patients are saying, what's great about having digital access to your healthcare information. And then there's some winner of a draw at the end. So stay tuned for that. SecureMail connects you and your care team. So there are over 45,000 clinics that use SecureMail across North America. There are about 80,000, I think probably close to 90,000 patients that have SecureMail accounts right now. And the reason why we use it is to help keep information safe. So if you go on the internet and type privacy breach healthcare, you'll see a lot of things happening, and news of privacy breaches in healthcare is ramping up because, unfortunately, cyber criminals are taking advantage of the situation, people's desire to be well informed about COVID-19, and doing things like sending people email messages that are actually phishing attacks. And phishing is a form of social engineering where they trick you into believing you've been sent a message from, say, the World Health Organization about COVID-19 pandemic related information, when actually what they've done is sent you a link that contains a virus that then downloads into your system and does a few nefarious things, like maybe lock up your information. In the event of if that's getting into a medical clinic, there's terrible repercussions of that. So we don't want to be involved in the spread of any viruses, but SecureMail is there to protect your information. We'll talk about in the next couple of slides about how it's different from email and some of the risks that email poses to your information, and what SecureMail does differently. So it also allows you to communicate with your providers efficiently and effectively. We've all been using email, some of us like me and Mark, since sometime in the 1990s. And so we are used to it in our day-to-day life. It's not a typical practice in healthcare because it's not secure or compliant with privacy regulations. And so using SecureMail, now you can have one inbox that you can collect all your healthcare information, your test results, your different medications perhaps, or maybe information about some loved ones that you might want to reference on an ongoing basis for your healthcare. And we'll talk about that with Paul when we get into that and how that looks from a patient perspective. Looking at the risks of email. So the way email works, and Mark can talk about this too, so feel free to chime in, Mark. if your computer is infected, or someone that you know has an infected computer, we've all received those emails that don't look quite right, or we have to call our friend to say, hey Jenny, did you really send this to me? It doesn't look like you did. Some of those emails are easily identifiable, some of them are not. So email comes through, and the way the internet actually works, email travels the general internet. Even if an email is encrypted, it's not necessarily safe. So you can see every step of the way, each one of these yellow arrows and the black question mark boxes is a potential point where information might get captured by someone else. So if you've got private healthcare information about a condition or a treatment that you likely don't want leaked into the public realm, email is not a safe way to transmit that information. We have no way to know which servers that are connected to the internet that email is going through as it moves from, say, your provider to you, or you to your provider. So we don't know who's grabbing that information.
And Jeff, if I could just chime in here on this as well. I mean, that
Yes.
in the diagram you're showing there, in that central cloud, you have 5 black boxes that your emails will transmit through as they're going from a patient to a doctor, or vice versa. The thing that's more insidious about this is that path is entirely unpredictable. So you could send 10 messages in a row, and every one of them would take a different path. And each path could involve a dozen different servers. And because neither you nor your doctor have any control or understanding as to who's running those servers or what they might be doing with your information, it breaks what's called the chain of custody. And your health information is so important that it deserves to be protected from sender to recipient every step of the way. And that's what I mean by chain of custody. So by sending messages through traditional old-fashioned email, that chain of custody is broken, and there's no way to confirm that your information is being handled appropriately by those middleman servers.
Yep, exactly. And of course, we're not going to get into the full risks of patient information getting out today. That's not the purpose of this webinar, but we do have a video on our website on the patient page. If you just hover over the About link on the top of our webpage and click on For Patients, it'll take you there. You can watch a quick video about that. So now let's take a look at SecureMail. So SecureMail is actually, it looks and feels like email, as you probably already have noticed. But the difference is you're not actually sending information across the internet. So what we do is we establish a secure connection between your device, whether it's your mobile phone or your tablet or your laptop, and then we connect you to our secure servers where all the information is housed. So you're actually, when you send a message, you're actually really just composing a message in our system and uploading any files there if you want to send photos or videos to your clinician for them to review. And that all stays within that. And you're actually, by sending a message, only really just assigning access to that to somebody on the other end. So the information isn't transiting the sort of public internet as email does. We keep all that information safe and secure, and we're tested regularly to make sure that that compliance and the privacy and security is ongoing. Mark, do you have anything to add there before we move on? I think maybe you're muted.
Yes, of course. Thanks, Jeff. I was on mute. I apologize. The only thing that I would add to that is one of the big things that keeps SecureMail so compliant is that we are by invitation only. So when you started using SecureMail as a patient user, you were likely invited by a doctor's office or a dentist's office or some other medical professional, and that's how you came into the system. So your doctor or medical provider was vouching for you and inviting you into the service. Unlike regular email, where anyone from Calgary to California to Kalamazoo can sign up for an account and assert they are someone that they're not, we don't allow for that to happen within SecureMail because we vet and verify all of our users through a process that we do internally. So it's an enclosed system, and we keep the bad guys out.
Yep, and that's part of the reason why you had to enter your date of birth when you signed on for your SecureMail account at the beginning.
Right.
So SecureMail benefits for clinics. We talked a little bit about this, but there's tons of research about the benefits of secure email in a clinical setting. Some of that is, revolves around increased clinic capacity to treat more patients. So you can think about it, depending on the clinic, the average time for a physician to meet with a patient in person can be 6 minutes. If they're really fast, it can be 15. You look at some averages. I think the average in Canada is around 15 minutes. So you probably can think of different scenarios where SecureMail is an entirely appropriate way for you to get your concerns dealt with your physician. Physicians, according to a whole lot of research, can respond to one of your concerns in about 2.5 minutes. So you can see that there's great efficiencies for the clinic to do that. Some cases where it might not be required to have an in-person visit, the physician can just respond to a message through secure mail, and that saves time and space for other patients that might need to really be seen in clinic for more complex cases. They can be seen much sooner. And in cases like that, we've seen clinics that have increased their capacity to treat patient concerns 20 to 50%. So they've added, almost in some cases, they've doubled their capacity to see patients in the run of a day just by using secure mail with some things up front, or by addressing different issues to get those patients out of the clinic to make room for patients that really need it. Secure mail also reduces ecological footprint, so paper waste. Clinics don't have to mail anything out anymore. They don't have to use their fax machines. They're not licking stamps and sending out information that way. So we do have clinics that we work with who are saving thousands of dollars a month, literally because they're not spending as much money on printer ink, and they're not spending any money on stamps, envelopes, that sort of thing.
Not to mention the time and money saved, but not having to drive down to the office to pick up a lab requisition form. If you can get it from home, it saves you that many minutes
Yep.
and hours and gas in your car. So
Yeah, exactly. And the other thing I would point out in the same kind of realm on the clinic perspective, you know, if you look at certain jobs that are done in a clinic in terms of organizing documents, compiling letters to go out, all that sort of stuff, if you can do it in a few clicks with a secure mail message versus collecting documents, printing them out, stuffing envelopes, getting them from different places, all that stuff, we have clinics that we work with that are saving 50 to 75% of the time that they're spent on that. And depending on the clinic and how busy they are, sometimes that adds up to a month of time a year that they are saving their staff, so they can actually focus on things that are impactful for patients. So let's take a look at our interview with Paul. So I spoke with Paul this week, and I'm just going to play his video. It's a little bit choppy in place, but hopefully it comes through okay. Paul, thanks for joining us today. I appreciate your time, and just want to talk a little bit about your secure mail usage with your clinic. I know you've been using for a few years. Can you talk to us a little bit about, how long have you been using it, and like which of your providers are you using it with?
Yeah, we've been using it for a number of years now. I don't know how long it's been. It's been a few years though. We've been using it with our family doctor for both my wife and our kids as well as myself.
How often would you say that you use secure mail, sort of in the course of a year or a month? Or
Definitely with my wife and the kids, we use it more than I personally do, just because I don't go see the doctor as much. But I probably use it at least, I would say, maybe once a month. If there's a question back and forth with the doctor. My wife is a little bit more often, especially just trying to get stuff going with the kids and the doctor. So they're probably 2 or 3 times a month.
and without getting into too much detail about, patient information, like what sort of things are you using it for with the clinic?
It's kind of neat. It's actually just about everything, really. So anything from, I've got a question, I've got a pain in my leg or something, and we set up a call with the doctor. So being able to actually set up the calls with the doctor has been one way. And then because of COVID-19 recently, we've also had the doctor actually do a call with us, but based on the information that we provided in the communication over Brightsquid. So just general information like that, and then just questions about the kids. So the kids are they're growing. We're making sure that they're on the right trajectory. If there's any personal questions that we have with the kids that we want the doctor to give us information on, she's been really good about getting back to us. It's just about generally everything, really, Jeff. It isn't. We haven't found a limit. It's just like emailing your doctor.
Yeah.
So,
And
yeah.
so, and you said, so your doctor is pretty responsive. Are you messaging the doctor directly, or do you go through the clinic? Do you talk to the clinic first and then they connect you, or how does that work?
It's a bit of a mixed bag. So for me, I've only been working with the front reception, but with my wife, she's actually been emailing directly with the family doctor.
How do you think it's changed the way you work with the clinic and your doctor?
I'm very much an email person and an IT guy, so I really do appreciate being able to send an email and not have to, wait for a phone call back or have to talk to somebody in person. I can just send out the request saying, "Hey, it's been a year since my physical, for instance, or whatever the time frame is, rather, and I'd like to set up a time." And they get back to me with a few times. I can check my calendar and then reply back. So it's been really good. It doesn't feel as though on the spot you have to make a decision. You have to have all your information right there. It's easy enough to just send an email, get it back when you're available with the information. You can just reply, and then the convenience of you can reply at any time, in the evening, in the morning, middle of the night, and they can do the same. So it's good to wake up in the morning and there's an email notification that I can go check.
Was there a learning curve getting started, or was it something you picked up? I mean, I know you work in IT, so technology is kind of a thing, but what do you think about how it
Yeah,
works?
it wasn't that bad. I mean, it's set up to send an alert to my personal email. So when there is a notice there or an information, it'll say you've got an email from the clinic, and so they've got the link right there in the email. I click on it, I log in with my credentials, and then I can check the email, and then I can send it back. The big learning though, if I was to say anything, was you can't forward an email out of that system. Like if I want to send my wife heads up, hey, by the way, here's what my doctor's saying, or vice versa, you can't send it out of there, which is by design, obviously, right? The whole point is for it to be secure and it can't go in and out. So that makes sense. You can only communicate with people on that system, and I kind of like the feeling of it being that secure. That this is my personal information. I don't need to worry about it accidentally getting out there.
So in that sense, I mean, that's obviously an important issue for patient information. What's your favorite part about using Secure Mail?
Yeah, just that. Frankly, the fact that it is secure and that I do feel confidence that I'm not going to be accidentally sharing information out or accidentally hitting forward a reply or somebody else doing the same with it. It is very locked down. And, the fact that it is that locked down and this is very personal information, I do feel that level of security.
And have you looked in the directory for any other providers, like your dentist or anybody? Would you consider working with them through Secure Mail as well?
Oh, I totally would. I haven't looked in to see if they're in there, but if they are, yeah, that would definitely be much easier. It's a great product, so it's nice to have that. It was definitely, it just feels like you're more engaged and more connected to your doctor's office now, right? As opposed to before, you call in, you're on hold, you're waiting, and then they're getting back to you. You gotta check voicemail, and I don't know about you, I don't like checking voicemail or taking calls. So it's nice to have email and just be able to have that. I generally feel like they're more accessible now. If there's any clarification, it's all in email. It's not like I have to sit there and have to explain it over the phone, or I lose my train of thought, or they say something to me and I got to reference it back and I can't because it was a phone call and I don't remember what they said. So at least I've got a record. I can go back to it and I can read it.
Yeah.
If I need more information, it's accessible. It's at my fingertips. It's nice. I'm really glad that you guys have the service out there.
Is that the end of the video, Jeff?
That is the end of the video. Yeah. So that's Paul's perspective. I mean, in my conversation with him, they use quite a bit. Hopefully that's helpful in terms of how it works with your clinic. If you haven't had a chance to use it very much, what we've seen is that clinics are very open to accepting patient messages in new ways. I've sat with clinics, and Mark, you can attest to this more than I can, but sat with clinics who got excited when patients started figuring out things like sending them videos and photos. It's stuff that you're not necessarily able to reproduce quickly in an appointment. But let's move on, because I just want to talk quickly about how that works from a clinic perspective. And Mark, you'll take us through the demo in a minute right after this. But This is what it looks like when you send a secure mail message to your clinic. They're actually using what we call the virtual front desk, which is really a shared inbox. So all the staff on the team, the people that you see sitting behind the front desk when you arrive at your clinic, they have access to the clinic inbox, and that's where you're addressing messages. And Mark will cover that in a minute. And then at that point, staff can make decisions about where those messages get directed if that's something they can handle on their own without having to take any time from the doctor or clinician, or if there's a clinician in the office, if they have a nurse or a dietitian or somebody else that would address the message. And then if it's a question for the doctor, and I think the statistics show somewhere around two-thirds of messages that come in from patients end up being addressed by the doctor in some way. The doctor can then send advice back through the clinic, and that comes to you, and we get you the care that you need appropriately. So, Mark, why don't we turn things over to you, and we can go through a demonstration about how things come together from that standpoint.
Yeah, sure thing. Let me turn on my screen broadcast here. Oh boy. No, that's me there. Okay, so you should be seeing my screen right now, which is showing my regular old-fashioned email inbox. We're not in secure mail yet. I'm just simulating sort of the process that most of you are probably already familiar with, where I've received a message from my clinic, and I'm now going to log into my Brightsquid account and review the information, respond to it, and I'll show you a couple of quick tips and tricks. So in my inbox, there's a message from my practice called the Fauchard Clinic. And if I open that message up, we see the notification letting me know that I've received this new message. So I'll simply click on this link here and log into my account. As I log in, of course, I'm asked to enter my username and my password. So that's easily done. And then here we are in my secure mail inbox. I'm on a test environment, so occasionally little errors pop up. But this is an example of the message that I might have received. So in this example, my doctor has sent me a little note. And actually, I should point out, it's not actually my doctor that sent me this message. It is someone in the doctor's office, in this case, Clara, who is probably the office manager, the medical office administrator, what have you. And she sent me some information about some diabetic issues. There's an A1C chart here. There's some other insulin level information and assessment forms. So all this information that Clara has sent to me, I could of course download and save to my local computer or my phone or tablet if that's my preference, and keep a copy of it for later. Now, to be clear, this information stays in secure mail forever, basically. So it'll be there for you later on. And one of the things that Paul mentioned a moment ago in the video that Jeff played, it's really helpful to have stuff in writing. I'm a dad, but I take my kid to the doctor, like my son to the doctor, and when I get home, my wife says, "What did the doctor say?" And invariably, I'll say, "I forget." Because that's how I am. But if the doctor secure mails me the results, the information, the instructions on how to use the medication, I'm much more likely to follow those instructions closely. So that's one of my favorite benefits of secure mail, is that it helps with my faulty memory. Now, of course, when I receive a message from my doctor's office, I can reply to it. You may have experienced this already. When you reply to the message, in most cases, that message is going to go to the clinic itself. You'll notice up here in the to field, I've got the message addressed to the Fauchard Clinic as opposed to sending it directly to Clara or directly to Dr. Fauchard. And that's because we use that concept of the virtual front desk that Jeff mentioned, wherein there's a team of people, just like when you phone the practice, there's a team of people that are managing those incoming messages and allowing the doctors to focus on doctoring, doing their clinical work. So that way the staff handles your messages. They'll respond to you directly. They may forward it to the doctor, and they'll take care of that within the policies and procedures that are appropriate for their clinic. Now, I'm going to cancel this message, and I want to show you something very interesting. Kind of a bit of a tip here. It was mentioned when Jeff was talking to Paul a moment ago, which is when you were invited to secure mail, you were invited by one of your medical providers, maybe your dentist, your doctor, your spinal surgeon, your chiropractor, or what have you. But you're not restricted to only using secure mail with that doctor's office. You can actually go into the directory over here on the left-hand side of the screen, and you can search for all the doctors in your city and go ahead and start communicating with them through secure mail. Now, not every doctor in the world has a secure mail account yet, but a large number of them will be available here. So many, so I think last time I checked, there's about 80,000 practices in the system that you may find. So there's a good chance your doctor will be there. You can filter by the name of the practice, the city, the state, even the specialty. So if I just want to see dentists in my area that are using secure mail, I can filter it like so and find all of the dentists in Calgary. And here's a whole bunch of dentists that I may want to communicate with. Now, when I send the message, I may choose Dr. Littlekin here, Dr. Jean Littlekin, but you'll notice that when I go to click on send the message to him, instead of going to Dr. Littlekin directly, it's instead going to go to his clinic, the OK Clinic. So again, messages get routed to the front desk and handled by the front end staff rather than going there directly to the doctor. Now, I went through the directory to address that first message, but I could also have gone right into here and just typed in the name of my favorite practice, my most recent connection, or anyone else. One common question that we often get is, what's my doctor's email address? I want to send them a secure mail message. You don't actually need your doctor's email address. In fact, all you need is the name of the clinic or the name of the person. So if I type in Dr. Pierre Fauchard, which is the name of the doctor here, and we search for Pierre, there's the doctor I'm looking for, and he works in the Fauchard Clinic. There's his email address, so I can confirm that he is who he says he is. But now when I click on that link, the message again gets routed to the clinic. So you don't necessarily need to have someone's email address. In fact, the practice name or the person's name generally works a lot better. So I know we're keeping things short today, so I'm going to stop at that point. If there are any questions, if you'd like me or a member of my customer service team to call you back to answer some specific questions, go ahead and enter them in the questions panel in the GoToWebinar section on the right-hand side of the screen. It's private, this comes to us. Don't tell us any medical information, but if you want to give your phone number, I can give you a call after this and answer any questions you might have. Jeff?
Yeah, thanks, Mark. I am gonna, I have to change myself back to the presenter. Here we go. Okay, so before we wrap things up, we just want to talk about some benefits generally for using secure mail or virtual care to the system. There's actually great benefits to increasing the usage of virtual care throughout the healthcare system. And so obviously right now promotes social distancing, so you can get the care you need and stay in contact with your clinicians rather than, there are some services that allow you to connect to a doctor somewhere who doesn't have the same access to your existing information that your clinic does. So we always recommend that you try to stay in contact with your clinic if you can, and this supports that. There's research that shows that Canadians could save 70 million hours a year, which I've done the math before, and it's several years within a year. If we could just get things like prescription renewals and normal test result reviews done via secure mail rather than requiring a clinic visit. I think the average time for a person to go to the doctor in terms of time out of their day is about an hour and a half. So that's where those numbers are coming from. We know that from our discussions with the 80,000 patients that are using secure mail, over 75% are not comfortable using email to discuss healthcare information. Even if some clinics ask you to, hey, sign this waiver saying you're okay with us emailing your information, we don't recommend you do that. And that actually doesn't absolve anyone of keeping your information private and secure. We also know that about 85% of patients would like to communicate with more than just the physician or the clinic that invited them. And it's shown to increase patient satisfaction by using secure email as much as almost 50%. And it also improves health outcomes. So there's research that shows a couple of secure mail messages back and forth with your clinic or your clinician in the run of a few months actually does improve health outcome measures for patients. A lot of that has to do with like what Mark mentioned. I have a note I can refer back to. So treatment adherence goes up. You don't have to worry about forgetting what it was you discussed because we know that as much as somewhere between 30 to 80% of information you'll hear in a physician appointment is forgotten by the time you're back in your car. And secure mail also allows you the ability to work around your schedule. It's not about scheduling a phone time, calling into the clinic, getting a voicemail message that says call back later. It allows you to send your message and get a response when that's possible. And you can see in this diagram here, this kind of shows you as part of the healthcare team. So virtual care systems like SecureMail allow you to really join the healthcare team and work for the benefit of your own health. Quickly, echoing a lot of the stuff that Paul said. Patients find SecureMail to be easy, fast. They like that it's private. I think when we asked patients what they like about it most, 95% of people said they really appreciate that it's confidential. It's fast. It's an easy way to get things documented. I don't have to always go to the clinic, and people recognize it's a time saver for their physician as well, so we can help focus on that clinician time. So that brings us to our time here. I will say our winner for the draw today is John R. So John, congratulations. We'll email you out an Amazon gift card. Thanks for tuning in. And we will be doing more of these webinars. So we'll talk more about how SecureMail can be used for you as a patient, some of the areas that we help address in terms of privacy, compliance, the things you need to be aware of. And we'll be doing this on roughly a monthly basis. Because you're registered for this webinar, you will be receiving a notification about the next one coming up on June 19th. So we hope to see you back there. And thanks for tuning in. Any last words, Mark?
No, thanks. We're good. We're at the end of our time, so I won't take any more.
Perfect. Thanks, everyone.